It's nice to be here. I know some of you from different parts of my life, and it's nice to see it all come together in a circle. Now that I'm an academic, I feel like I need to start out with some definitions and sound very, expert or something. But so I'm going to take us to a level of more specificity about, I couldn't even begin to be inspirational, so I'm not going to. Those who preceded me did a wonderful job of that. So we're going to talk about some more specifics in terms of advocacy. So basically, advocacy is a set of skills that are employed to influence policy, to get the kind of changes that we want. This can be done at the private, within private organizations, but we often think about it as public, at the local level, state level, federal level. It's working together in support of a particular issue or cause, something that you believe in, and those of you who have done advocacy, like Jane and others, can say that it's much more successful when you really care deeply about what you're working on. There are paid lobbyists who can do the steps, but those really effective change happens when there are people with passion who are really working on that. And there's no shortage of that in this room, so that gives me a lot of confidence. And advocacy involves education and action directed at changing policies, positions, or programs. So Marilyn gave us some discussion about organizing, as did Jane. I'm going to not talk about the more broader ways of organizing, but really advocacy, which really is a narrower function, an important one, but a different one, as Marilyn, I think, pointed out, than more general organizing. So we're going to talk about how you would do an advocacy plan around an issue first. So the first thing you really want to do is to clearly define the issue. And I will say that now that I'm a teacher, I didn't realize how, I'm learning how difficult it is for all of us to really define the problem. And that may sound kind of dull, but it really is important to understand what is it exactly that you want to address. What is the policy issue that you want to deal with? What is the proposed recommendation? Who is being affected by this policy change? What are the current and potential resources available to support the policy change? And I would maintain, in my years of doing this kind of work in a public organization, as Shirley said, I was at the health department for a couple of decades. I had the pleasure of working under Dr. Mason's leadership for the time that he was there. It's really important to know how it's going to get paid for. Because if you don't think about that and leave it to the General Assembly or the City Council, you may really have some unintended consequences. And unfortunately, I can give you a lot of examples, but I will just give you one now. There has been a lot of advocacy around HIV funding. And as someone who teaches policy, that is an example of an area where we can learn a lot from what AIDS advocates did to bring money to the problem of AIDS. As Dr. Mason can tell you, when you look at the percent of dollars, or the number of dollars that go to AIDS or HIV per case versus how much goes to hypertension or diabetes, it's quite extraordinary. And I'm a little hesitant to make a judgment about that, but let's just say that it is disproportionate in terms of relative to other diseases that are it's much more for HIV, much, much, much more. So there was successful advocacy to bring more money to HIV services. This was at the state level. And there wasn't a real clear plan about where that money was going to come from. And so what did they do? I mean, this is the kind of thing that brings, my body just shakes when I think about it, as well other people's in the room, where the money was taken from prevention. So we had money taken from HIV prevention to HIV services. Now, no one really wants to make a choice like that. But you never want, as public health, that is an anathema to us. And it was very challenging and very painful to deal with that. So think about how you want to get a proposal, that you want to see, hope I didn't break it, that you want to see funded. So clearly defining the issue, figuring out where it's going to come from. You want to break the problem down into manageable pieces. You want to decide which aspect of the problem that you want to focus on. And make sure that you understand, and this is also very important and not always easy to do, but find out where the locus of decision making is for the thing that you want to do. Because, as I'm sure you know, there are a lot of different levels where policy is made. Is this an issue that can be addressed at the administration level? For example, is there a rule about Medicaid, let's say, that you would want to change? Well, you might be able to just deal with the state governmental agency about that. Or is it something that requires a legislative change? Or is it something that maybe you want to go to the judicial branch about? There have been a lot of major successes in all of those when it comes to public health. But it's very important that you understand where the decisions are being made about the issue that you are looking at. So some examples for judicial, which a lot of people may not necessarily think of. The states, a lot of states are periodically sued because they are not living up to the federal requirements for Medicaid. So there was a court case several years ago in Illinois that, and the state lost, and the claim through the courts was that you're not spending enough on children's services under Medicaid, like dental and things like that. So the courts got involved and said, that's true, you're not. So we are forcing you to raise your rates for pediatrics, to raise your rates for dental care. So it was important for the advocates to know the best way to address that issue. Was it changing Medicaid law? Was it looking to the state agency? Or was it using the courts? So it's important to figure out where the best place to intervene is. You want to hone your message. That's another important function. What's the specific message that you want to deliver? And how can it best be shaped? And how can you use anecdotes to get your message across? So we started out with stories. The film that Dr. Mason showed, that was people's stories. As he said, I mean, that can be a very compelling way to bring your message across. Who are the most credible messengers for targeting the audiences that you need to target? And what is it that we want them to mention? We want to make sure that we have science on our side. Now, those of us who are in public health sometimes feel a little grandiose, and we think all we need is the science. But no, as other people have said better than I come, it's all about relationships. It's all relational. It's like, okay, there's a science, but what else is there? There's the people involved. There's how are they going to take the science? There's the politics. There's all these things that we may not want to deal with because we in public health sometimes can be a bit sanctimonious about, we know what's right. But okay, maybe we do, but we don't have to tell everyone that. We have to figure out how other people may be looking at an issue and try to understand, their point of view. You want to figure out what moral arguments can be used in terms of beefing up your position. So in this room, there is no shortage of that. And that is really a great place where religious leaders and people of faith can come into an argument and say, yeah, there's the data, there's the facts, blah, 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 but let me tell you something else. This is something that we all should care about because it has to do with justice. And you all who represent faith communities are in the best position to do that. And it's a great addition to the whole area of advocacy. So as I've said, you want to identify who your allies are, so you know whom to work with on issues. As important, you need to know who your opponents are and try to understand why it is that someone may be against an issue and figure out ways to try to bolster your argument. Who your allies are has been a very interesting question for me on issues that I've worked with. So I've done advocacy not only in my professional life, but also, interestingly enough, as in my personal life, as a member of faith-based coalitions, like those that many of you work in. And was very interesting to me is that you can work with a group on an issue, and I'm sure that Jane has lots of examples of this, where you work on housing or issues of immigrant rights, and you may work with a lot of people of very different faiths and backgrounds who share your belief about a certain issue. but you don't want to talk about something else with them necessarily. And this is a really, really key point, I think, about interfaith work. If your issue is housing, then you may not want to talk about the gay rights bill, that's in the state legislature, or talk about immigration, or talk about women's reproductive health issues. Because don't assume that because you're working together on housing or healthcare or public health, you're going to agree on other things. So it's really important to identify your allies on the particular issue that you're working with, and not to make assumptions that people are going to agree with you on other things. And I think this is especially true when you work with very diverse, faith-based groups. And so just to talk a little bit about even more nitty-gritty, but just some of the tactics and tools that you can use in your advocacy. Coalition building, and all the folks who've come before me, it's really implicit in or explicit in the work that folks are doing, but you really need to find people to work with and develop coalitions. And I know that that's what this group really is all about. There's a very practical reason for doing that policy and decision makers are more likely to seriously consider requests of multi-sector coalitions that have a wide influence and are very diverse. So it's a very practical, not only is it the right thing to do, but it's a very practical thing to do. They like to see that different people are supporting a particular position. It also increases your access, also very practical. It increases your access to resources and contacts and networking that can prove useful for long-term advocacy work. And so you're coming together on an issue, and not only will you maybe not agree on other issues, or probably not agree on other issues, but you also may not agree on specifically every way that you want to see like a certain law implemented. For example, the Affordable Care Act. There were a lot of people who supported the Affordable Care Act who maybe didn't like every piece. Obviously, a very big problem with the Affordable Care Act, which is still a big problem, is that undocumenteds are not covered. But there were people who said, you may think that part of the law is good, and I may think part of that law is bad, but we still want to see the law passed, and we're going to hope to fix the other stuff, which sometimes works and sometimes doesn't work. So that's where this very practical nature of coalition building, I think, has to take place, where figure out exactly what it is that can be your common message and leave the other stuff to later, which is hard when you feel like you are so right, which of course we all are about all things, but sometimes we have to put a little bit of that away. You want to look for unusual partners. You want to look beyond the usual suspects when you look at developing a coalition. And for my work at the health department, and some of my former colleagues may remember this, but we wanted to pass a bill at the state legislature that would allow for the purchase of syringes without a prescription. And the science was on our side. We thought, no problem, the research is there, making syringes available does not increase drug use, IV drug use, and does indeed decrease HIV transmission. And there were a lot of people, especially in the African American community, those communities that have really been ravaged by HIV and by drug use, who couldn't really deal with this. They didn't even want to, one legislator did not even want to touch the piece of paper of this lovely fact sheet that we had put together, because this was so fearful for her that it was going to increase drug use, and what if there were, dirty syringes lying around the playgrounds, and certainly good things to worry about, but we felt like we understood that really wasn't going to happen. So we were having some problems, but someone much smarter than I figured out that a leader in the state Senate's wife is a diabetic, and wouldn't this be wonderful if she could have access to syringes without a prescription? And he was a very powerful senator from the Republican Party, no less. And that was kind of a strange bedfellow who really helped forward this legislation. So be open and be creative, when thinking about some of your partners. So another way to really get changes in policy could be a rules change. It may be that you don't need to go to the legislature and the courts aren't the most appropriate, but you want to change a rule. like, for example, let's see. Oh, there's lots of examples of that, but let me think of one. There were rules about Medicaid at the federal level that said that there is a law that if you go to an emergency room and you're having an emergency, well, you don't have to have an emergency, but if you go to an emergency room, the federal law requires that you be taken care of. But it really needs to be an emergency. So the question was, believe it or not, is having a baby, is that considered an emergency? So if a pregnant woman goes to an emergency room and she's undocumented, does the hospital have to take care of her? Now, for many of us, or all of us in the room, we would think that would be a no-brainer. But it wasn't, and we had to do a rule change to clarify that. So that means reading the Federal Register, having a sucker like me on your staff who has to read the Federal Register, and figure out what it is. I mean, there are tools of the trade that aren't that exciting as giving a speech, but you have to do it. So you figure out what the rules are, how to change the rules, and you do it. So you have to really understand all the places where you can intervene and the best tools to use to do the intervention. So we talked about litigation, we talked about legislation, we talked about rule changes. So in the legislative area, that's really the area that I think most people think of most commonly in terms of doing advocacy. And this is where you really where the public forum is really very important. So you want to know some tools in using the media, letters to the editor, public service announcements, press conferences, trying to figure out ways to enlist journalists to maybe conduct an expose, try to get on talk shows. Social media, obviously, is a big thing. And by the way, there were some materials that I made available to you that were from an initiative that actually Dr. Mason was the leader of when he was at the health department. And that was really before the explosion of social media, so there's not a lot on there, but a lot of the details that I'm talking about now are included in those materials, so you can have them as a reference. Testifying at various boards, regulatory commissions, legislative committees. Ways to directly lobby your city council. If you have a big enough coalition that you may have some of that money that Marilyn was saying we don't seem to have a lot of, you might want to hire a lobbyist or share a lobbyist, write letters, make personal visits, present testimony. You don't need any money to present testimony. If you are in the position of presenting testimony, just a couple of tips I think to think about that. Be prepared to answer questions and try to answer things as simply as you can. Don't dispute the other side's facts, quote facts, because you'll probably lose. Just really stick to really, what it is that you know. And this is where doing your homework at the beginning, when you're really trying to figure out what problem it is that you want to address by policy, is really important. Know your opponent's point of view. Try to be as simple as you can in your testimony. Now that I've said it twice, maybe you'll see that I think it's really important. And something that's very hard. For those of us who are in the data and in the ideas and up here somewhere, it can be very hard to make a simple case. But that is really, really important when you're doing successful advocacy. Try to avoid the jargon, which I'm trying to do desperately right now. And just try to make it as clear and as short and as simple as you can. But if you do have an opportunity to also present written testimony, which you generally do, that can be more involved and longer. If you don't know the answer, acknowledge that and promise to contact the legislators. I will say that the thing that makes me most crazy about politicians in my experience, both in my work and as a citizen, is not ever admitting that they make a mistake or taking ownership. So as someone who's an advocate, take the higher moral ground, which we all like to think that we're on, that we stand on, and say, I don't know, but I will get back to you. That's a good question. Show some humility and some honesty, in dealing with, I think, is really good. And I guess the final thing I would just say in terms of how to get your presentation, and I'm really repeating this point also, is the idea of storytelling and telling someone's story. That is really the kind of thing. I mean, it's good to have the facts and figures, and those of us who are in that more technical aspect of the work are happy to provide you with that, because it really does make your case more solid. But what we as humans, related to what Marilyn started saying, and we really started with our opening centering and our focusing, is it's all relational. So if you can have a legislator who can relate to a person who's lost their house, who doesn't have any food in the pantry, whose son was killed sitting on the front porch of their house, you know, they can really relate to those things. So I think that, I guess my last comment would be to really try to think of a way, when you do your advocacy, to have the facts, have the figures, make a really strong case, and also adding that human touch, I think, is also very helpful. So, thank you.